So now coming to the paired cartilages. The paired cartilages are the two arytenoid, the two cuneiform, and two corniculate cartilage. Two corniculate cartilage, we have to imagine there is two corniculate cartilage, two cuneiform, and two corniculate cartilage. So arytenoid cartilage is basically a pyramid type of cartilage. It has a apex where the corniculate cartilage is attached, and a base, a muscular process, a vocal process, a muscular process and a vocal process. The corniculate cartilage also known as the cartilage of Santorini, which is attached to the apex of the arytenoid cartilage. Another cartilage which is paired cartilage is the cuneiform cartilage, that is present just lateral to the corniculate cartilage on each side. It is a rod-shaped cartilage. It is also known as cartilage of Risberg. Now coming to the extrinsic membrane of the larynx. What are the extrinsic membrane of the larynx and what are the intrinsic membrane of the larynx? First we will talk about the intrinsic membrane of the larynx. Intrinsic membrane of the larynx are basically four intrinsic membrane. One is quadrangular membrane. This is the very important. Quadrangular membrane is a quadrangular, means four-sided membrane. That means it is present from the side of the epiglottis. So this is the epiglottis. So from the side of the epiglottis, it origin from the side of the epiglottis and attached to the arytenoid. So from the side of the epiglottis to the arytenoid, like this way, there is a quadrangular membrane attached in both side of the epiglottis to the arytenoid. A quadrangular rectangular membrane is attached. So along with the side of the epiglottis, there will be one side and there will be one base. So upper side of the quadrangular membrane at the epiglottis forms the aryepiglottic fold. And the lower border or the lower side of the quadrangular membrane forms a vocal cord. There will be vocal cord formation in the lower side. Here will be one vocal cord and here will be one vocal cord. These are the false vocal cord or false vocal fold, which is also known as ventricular fold or vestibular fold, because the space in the false vocal cord fold is the vestibule. So it covers the vestibules. Okay. So what is the space between the two false vocal cord is the rhima vestibule. The space or the cavity between the two false vocal cord is known as rhima vestibule. Okay. Upper one forms the aryepiglottic fold and lower one is the false vocal cord. Now comes to second membrane, which is the conus elasticus. Conus elasticus or cricovocal membrane means crico and vocal, means cricoid. Conus elasticus is a cone shaped membrane. So lower border of the cricovocal membrane is attached to the cricoid, upper border of the cricoid. So this is the cricoid cartilage. So upper border of the cricoid cartilage, there is a attachment of the lower border of the cricovocal membrane. So upper border of the cricovocal membrane, where it is attached, it is a free margin. It is free. It is attached anteriorly to the laryngeal surface of the thyroid angle. So this is the thyroid angle. Laryngeal surface of the thyroid angle, it is attached just below the false vocal cord and by a thick fibrous tissue it is attached. It is known as Broyles ligament. Or anterior commissure tendon, with which it is attached to the thyroid angle below the false vocal cord, and posteriorly it is attached to the vocal process of the arytenoid. So upper part is free. This upper part of the cricovocal membrane, which is free, is known as the true vocal cord or true vocal fold. Now, why it is known as conus elasticus? Because it forms cone in medially. It forms a cone in the medially. The tip of the cone is the vocal cord, is the true vocal cord, and hence it is known as crico vocal membrane or conus elasticus. Now the third membrane is the cricothyroid membrane. So it is externally present. So from the externally present, it is a thickening of the cricovocal membrane anteriorly. It is lie externally, but it cannot be considered as an extrinsic membrane, because extrinsic membrane is the one membrane which connects the external structure of the larynx. Okay, so it is the intrinsic membrane only. It is the cricothyroid. So from the cricoid to the thyroid, it is cricothyroid membrane. So these are the intrinsic membranes. So what are the extrinsic membrane? First is thyroid. So from the thyroid to the hyoid membrane. So this is hyoid bone. This is thyroid membrane. The thyroid membrane pierced by internal laryngeal nerve, which is a branch of superior laryngeal nerve, and the superior laryngeal vessels. Cricotracheal membrane. So from the cricoid, lower border of the cricoid to the trachea ring, first tracheal ring, cricotracheal membrane, and hyoepiglottic membrane. I have told earlier there is two hyoepiglottic membrane which divides epiglottis into suprahyoid and infrahyoid part. Hyoepiglottic membrane. So from the epiglottis to the hyoid bone it is attached. So these are the extrinsic and the intrinsic membrane of the larynx. Thank you.